Hello, boo. Welcome to our 4K webinar. It's Halloween style.
It's Halloween again. It's
Halloween
Halloween again,
again.
Laura.
Yes, on the day. And we got Dr. Tully for Ask the Vet. And I don't know if it was if they're view, but I got Lisa's working behind. Well, I think Lisa's gonna have to be not behind the scenes today because you got to see who Lisa is. Lisa Bono. Let's see. Lisa, you got to say something so it gives your screen activated. And let's see what.
Oh, okay. I didn't know that. I was trying to figure out how to get me on there. So
Show
are
on
you
the
able to?
side, your side, the side with the eye. You have an eye on the side. Oh, there it is.
Oh my goodness.
And the feet.
Wow.
My tail,
If you
my
haven't
little
guessed already,
feet.
Lisa is an African gray, which is Africa. So, and I know that mine is a little bit more ambiguous. So I have to explain. I got marshmallows. I got a camp. I'm a happy camper.
And you
That's
look
my
like a
last
happy
minute costume. That's all I got.
camper. Just watch out for scary things coming out of the woods.
That's why I got this. This is my weapon. I'm an actual happy to get you camper. No, just kidding. No. I'm a happy camper this whole episode here. I hope if you're just joining us, one, let us know where you're coming from, and two, let us know if you're dressed up. So I know if you dressed up today already. Yeah. And then Dr. Tully, you of course are the if I was a client and you came in as my vet today, I would be a little bit scared.
Yes, I don't think that this would instill confidence in my abilities.
No, no, no. I feel like my costume would be the least likely to scare a bird. I don't know. If they
No,
have a step-up stick, like anything.
you'd be given treats. Here, have a treat.
Yeah. Oh my goodness. Okay. Wow. Okay, this is gonna be fun. It's all right. So everyone's got. I love the recording after this because people, if they don't realize it's a Halloween episode, be like,
Yeah, like what in the world's going on here? But this is fun
"Oh,
time of year, a fun time of year, and and we've had a lot of great webinars over the year, and it's good to as we get into the shorter days, and again, daylight savings time goes off on Sunday, so remember that we get an extra hour of sleep on Sunday, and so that's good.
that's true." Or do we? Depends on what the flock thinks to be time change, right?
That's true. That's true. Uh,
All right. All right. So we should. All right. Let's see what if you have a question for Dr. Tully, use the Q&A button and not the chat feature. And
and then the one thing I want to do, Laura, is kind of touch on and kind of review. We had the yellow cockatiel syndrome, if you recall, on
yes.
the last webinar, and so I had mentioned like, I haven't heard of the yellow cockatiel syndrome. Okay, and I had mentioned that I thought that that possibly it had to do with the Latino cockatiels that in the different genetics as it took place to develop the Latino cockatiel line, and that we had the kind of the lack of feathers on the back of the head, and maybe having not as much immunologically competent as some of the normal colors, normal gray, and looking that up, and we had at least one of our webinar attendees submit some information and what it is, that in fact yellow cockatiel syndrome is just I guess some of the what we call it issues more that are associated with some of the Latino cockatiels with lack of feathers. Some of them don't have this, but some of them do, and maybe they may not be as, like I said, immunologically competent as some of the more hybrid, just the normal vigor in grays, as far as expected, their life expectancy is a little shorter, has been. It doesn't mean that one can't live like we talk about life expectancy, that you can have you have outliers. You can have outliers, but in general, with the Latino cockatiels or the highly inbred lines to develop color morphs that you'll not as quite as robust as a normal coloration birds. So there you go. But very good, interesting, subject that was brought up last time.
No, that was for sure. And that was very nice of you to circle back and find the answer. Right. And so let's see, we have, and once again, if you're using, if you're going to ask a question, use the Q&A button instead of the chat feature. And let's see. Okay, so sorry, they're saying sorry if they had to repeat this, but what probiotic do you recommend along with antibiotics in place of Benebec? Thoughts about trying to get Benebec for birds made again. So,
well, yeah, that's a great question, because probiotic supplementation, and I've mentioned this on the webinars. We've had a few. So there's there's a number of topics that we touch on that we come back to. The probiotic is one of them. I think it's a very good subject, because theoretically, and of course, the microbiome is kind of a subject du jour. It's a hot topic, and I think that rightfully so. I think that we're learning more about the whole yin and yang of the health. And I always have mentioned that the overall health of the patient or the bird or whatever, the human, the animal that we're treating, goes a long way in the ability of that animal to be healthy and also recover from any type of a disease condition. And finding that the microbiome and all of the organisms that live within the body, if they are functioning and happy, that it kind of has a ripple effect on everything. And so looking at this, the GI tract and the ability to for the digestion, proper digestion, adequate digestion, getting the supplementation from what is ingested is optimal. And and so when you're looking at that, it's like the probiotic supplementation, and you look at birds that are feeding their young. Okay, if you've raised birds, one thing that you'll notice is that if you ever go look at a baby bird, the crop is never empty. It's always full, and so and how does that happen? It's the mother bird feeding the young, and what's happening there is that there is transfer of microorganisms from the mother to the young baby. So it is actually inoculating that young bird with microorganisms that theoretically or in reality are helping that young bird populate its GI tract with good organisms to aid in be healthy and aid in digestion. When that goes awry in situations like if you have the birds immunocompromised or pathogenic bacteria is involved or something occurs where there's a disruption in that normal flora, then of course you get regurgitation, you get crop stasis where the food doesn't move through, you get diarrhea, you get the intestinal tract. And so that's when we look at making trying to identify what the problem is, and it may well be bacterial infection. It could be, we're talking about bacterial things. There's other things that can cause it, but yeast, candidiasis, or something, or a combination of both. And then, so you want to make sure that you can treat that, and often antibiotic therapy is involved, or antifungal therapy, or something against a yeast like a candida. But you want to have good bacteria in there, and so that's where probiotics come in to play. Whether you're hand feeding a bird and the mother's not being able to inoculate that bird on a regular basis, or you're treating with an antibiotic. And that's a double-edged sword. That's one where it kills the bad, but is also getting the good. Okay. And so for the most part, you want to target the bad, but you're doing some harm to the good also. And the probiotic supplements, unfortunately, there's not a lot of evidence-based information on a specific product. We've done some research on that, the Benebac formulation. What we did find is it didn't do any harm, okay? And that's what I've emphasized before. But with a probiotic supplement, what you're looking to do is, one, inoculate into that GI tract the bacteria, okay, the good bacteria. I'm putting good bacteria in there. And so so then you assume, well, if I'm doing that, everything's working. Well, not necessarily, because what you want is those bacteria to be active and populate that environment, to generate an environment that's conducive to good bacteria growing, and bad environment for the bad bacteria. Okay, so that's one of the things that you're looking for in that. One, to repopulate good, and also to create an environment within that your GI tract that's best for the good bacteria. And then the third thing is for that bacteria to actually adhere to the villi, on the intestinal tract of the bird, and that bacteria attached to the villi to protect it from the bad bacteria attaching there. So it protects the intestinal tract from the bad bacteria. So you want to know why you want to give probiotics. That's the three-pronged reason that if it worked optimally, that's what you're looking for. Also, what has always been stated is that if you have an African gray, that you would give African gray probiotics that are obtained from African gray to African grays. If you have a rabbit, that you give it to a rabbit. If you have a cow, you give a cow probiotics to a cow. A human probiotics to a human. The problem is that there's not any company making African gray probiotics, much to Lisa's dismay.
Yeah.
But what they use is the most common bird out there in production, the chicken, right? So at least we have what you're looking for is an avian probiotic. And so that is going, and so what you're looking for is the best. So what do you recommend? What do I recommend since Benebac is gone? And what we use is the Necton probiotics, Nekton. Necton makes it's a vitamin and avian vitamin and supplement company out of Germany. We've been using their products, Necton S, Necton Min, They've had, I've been using their products for over 30 years. I'm going to kind of reduce the number there, but they do have a probiotic supplement, and that's what we use in the hospital at this time. There are other products, and like I said, there's not a lot of scientific evidence-based information out there that, oh my God, you use this and it's just going to work, and it does amazing things. There's a lot of hope in this. We know that it's not going to do harm. I feel that the probiotic supplementation should be given on a daily basis. I know that the Benebac product, it was like every other day or whatever, and I tried to tell the company, I said, well, look, if you have a mother, the hen that's feeding the babies, it's inoculating them every time it feeds it. It's not like, well, today I'm going to inoculate you, tomorrow I'm not going to inoculate you. It's not like, can't control that. And so, I mean, if you're giving a probiotic supplement, I thought, and what I used to with the Benebac would do it every day. But we did seem to see some trends or evidence that maybe the birds that were growing grew a little bit more, had a little bit more weight gain, a little bit more robust, but it was not a significant amount with the Benebac formulation. We looked at growing birds. It's very difficult to look at, say, birds that are ill, but nonetheless, that's what you're looking at. And I know that there are some other products out there, so there are other probiotic products out there. And what I wanted to do in explaining this is that you take what I have explained to determine what the product is, and what your thoughts would be on how effective it may be. Okay, at least you have a knowledge of or information on how to assess the product that's out there, because there are multiple products out there, but you want to make sure that it's avian specific on that.
Okay. Question about okay. A baby Linny, so a lineated parakeet, got his first nail trim by a bird store that offers grooming. So 2 nails were clipped nearly to the nub this last Saturday. So today he's still keeping the foot up as much as possible, but there's no redness or swelling. So not sure, it doesn't look like an infection, but they're worried that he's still in pain. He's eating well, climbing okay, and walking okay. But any suggestions to help ease the comfort, any over-the-counter remedies? So little short nail trim.
Short nail trim. Yeah. Well, when you're talking about nails, and I always want to, and that's a good question, because I always want to kind of put it in perspective here, and I have to explain this to students. I get a new group of students every 2 weeks, so I explain it quite often. And so what you're looking at here is we use the term nail trim, but we're actually trimming a claw. It's the true terminology would be a claw trim, but we just use it kind of euphemistically as a nail trim. Okay. And so because it's a claw trim, it is painful. Okay, it is painful. And the one thing that we do to reduce that is many of the birds will sedate. We won't sedate all of the birds, but we sedate many of the birds, and that helps reduce the pain during the process. And then also we provide anti-inflammatory medication after the procedure. And the anti-inflammatory medication that we provide is usually for a 2 to 3 day, we feel, effect to reduce any pain that may be associated. I don't really feel, and again, it's dependent upon the patient, the nail, the claw trim, the nail trim, on that. But with birds, unfortunately, you just can't like nip the end, and that will be effective in many patients. There are many birds that never need a claw trim or a nail trim, never need it. Okay, there are some that need it because the owners get it out, and if they get it out, it's like barbed wire on their arms.
Yeah.
It'll just tear up their arms. It's very sharp, and they just need to be blunted. And then there's some birds that, as I call it, macro Velcro, where it just goes it grows so fast, it just goes in a circle. And then when they click into the cage, they can't get it out, and they'll rip it off, and so those need to be trimmed significantly. So there's a variables which ones that need it and which ones that don't. I have owners that will use emery board and just kind of do, and have the bird sit there, and they'll just, kind of file down the tip. And that, what that does is that you can't keep up with the growth if it's growing long, but that does help, and they don't get to the point of where it's bleeding. But if you are trimming the claw, there's a certain length that I teach as far as the claw trim is concerned, and so it can vary, but in general, what you're looking at is this is a kind of a diagram that I draw, and so you have the claw here, you have the toe. It's kind of, and then so in a normal position, this is about the level of the trim. Okay. Now, and so there is a method to the madness as far as the length is concerned. And this is normal. Of course, you can push the claw down or you can push it up, but this in a normal position, this is the length that I, usually recommend. Now it could, and we use specific either electric artery for small birds, so it doesn't bleed, or a Dremel tool for larger birds. But it is a procedure that it's best done if you're going to trim of any significance by somebody else other than the owner, because it can be somewhat stressful for the birds. It's painful. Like I said, it's something that is when the birds sedation. Can you imagine doing this on a macaw? And we have macaws that have their, and cockatoos where the claw goes all the way around in a circle, and sometimes curls, and so and so if you're going to do it properly, to a good length, you're going to have to cut off quite a bit. But if it was cut short, and even if it isn't cut short, there needs to be some kind of a pain, and like I said, we always give something like rabbinicoxib, or Onsior, meloxicam, if when we do a claw trim or a nail trim. So yes, it could be still a little bit in pain if it was a short nail trim. Yeah.
Oh,
Yeah.
you mentioned that some birds don't need nail trims and some need. So is there? You mentioned macaws and are there some bird species that need them more than others? You think that you like certain species that, or is it by wear and tear from the bird?
I'd like to, they say, well, how much, I guess it's more along the lines of wear and tear and purchase that may be in there. The more natural purchase, the more that there is on there that occurs. In the, they'll say, well, in the wild, we don't see any birds that need, they don't go to uh, the, manicurist and get a mani and a pedi. I don't know in the wild where that is, which tree, but nonetheless, in that in an enclosure that you have, I think that's going to help. But we do see the macaws can, and I think it's individual actually, and how that is, which ones do and which ones don't. And like I said, the ones that they could be somewhat short, but can be very sharp. And they just need to be a little bit blunted. And that's all you need to do. So some of those, but some of the birds, it just seems that I don't see how you could put anything in the cage. And if that's a situation in the wild, do they just break them off or what have you in nature? If they
There you
get
go.
too long.
There's your next study. You got to study nails.
Yeah, exactly.
Oh, sorry, I had one more follow-up question because I'm fascinated by nails.
No.
Younger birds like that, if they're really, do they would you want to hold off on nail trim because if they're
Oh, yeah, I mean, thank you, Laura. That's an excellent question. I just love that. Yes, by all means. You want little sharp nails on young birds. You want them to have purchase. That's the last thing that you want, is to blunt those nails and so they can't get a grip on their substrate. So yes, thank you for bringing that up. Yeah, and so you want to really delay until those birds get around, and it may be painful, but wear a sweatshirt or a sweatshirt sleeve, if you get them out, because the young birds, you want them to make sure that they get very comfortable, and so that also prevents splay legs where they can't get underneath. And so keep that in mind with young birds. And also younger birds, their claws are softer. Okay. And you think, like young people have soft skin, old people have crusty skin. And so the same way with birds. Young birds have soft in claws, and they're hard, but they're softer than older birds that have it's more hardened, and the younger birds' claws have a more tendency to be bleed a little bit more when you trim them. But of course, we use hemostasis and stop that. Yeah.
okay.
Yeah. So thank you for bringing that up. That's very important. Very important. You want those little birds, the young birds, to be able to just grip into and not slip and have good purchase. They're learning how to get around. They're learning how to walk. And so, yeah. Thank you. Great.
Well, I've got a question about two hand raised African gray parrots. They're both born in May of 2019. They're siblings, and yesterday the female laid an egg, her first egg. They're not interested in breeding siblings, so they shortened their daylight period. They are covered from 6 p.m. and uncovered at 10 a.m. the following morning. If this doesn't stop her from laying eggs, how can I ensure that she doesn't develop calcium deficiency? So their diet is pellets, fruits, and veggies.
Mhm. Well, I mean, the one thing, I mean, you have the pellets in there, you know, and it's always, and then the most important thing when you're looking at this is, it's always great to say, you know, and that's a question we ask when we, you know, go into the exam room. Well, what are you feeding the bird? You know, pellets, fruits and vegetables. Yeah, that's important. But more important, well, what is the bird eating? You know, oh, we feed him this, but he eats the cat food. You know, so I mean so or it only, we feed him this, but he only eats macadamia nuts. Okay. And so the main thing is that, you know, what does he eat, that it totally or what have you. Calcium, as far as calcium, to reduce the calcium, you know, any evidence of calcium deficiency, or to reduce the chances of that occurring. You always have a mineral source in the cage, a mineral block. You know, for smaller birds, would be like a cuttle bone. That's what the cuttle bone, the mineral blocks, what have you, are there for calcium supplementation. I like those better than providing oyster shell or something of that nature. And that way, the mineral block, you say, well, I don't see the bird eating it, but that may be the case. But I think if it needs it, they will. And then you'll notice from time to time, that's the case. And if and again, you have the fruits and the vegetables, and like I said, fruits are just sugar and water. Okay, that's just sugar and water. It's like a little, you know, tastes good. That's great. You know, I like fruit too. But you're going to get most of, you know, if you're going to get vitamins, your nutritional value will come from your vegetables, if they have it. But again, you gotta provide that and keep it where it's doesn't spoil and what have you there. But the pellets, if it eats mainly pellets, which I think you know, that was the case, then the pellets are impregnated with the vitamins and minerals, and that there's really it really reduces the chance of having low calcium. But you always want to have a calcium source in the cage of any bird, but particularly laying females, or they have the chance to lay. And you may not see them go for the calcium source, but that over time you'll notice a little bit off here, a little bit off. You know, they'll you know, you'll see where they've actually taken in some of that calcium source. So for smaller birds, you know, they have big cuttle bones from big cuttlefish. You know, and so you say, well, I'm going to get a big cuttle bone because I have a big bird. Well, a big bird could go through a big cuttle bone as quickly as they could go through a small cuttle bone, and it's not like they're ingesting it, they're just tearing it up because it just is fun. You know, it's just fun to tear up the cuttle bone. And so that's why the mineral block for your parrots or macaws or something is something that I would recommend. And for the cuttle bones, for like your budgies, your even finches, budgies, finches, and your, you know, cockatiels, things like that. Yeah.
Okay.
Oh, that's good. But you should be good with the mineral block and the pelleted diet.
Okay. Yeah, because we had the question about two Keats that don't use a cuttle bone or for their beaks. Is that going to be problematic?
Mhm.
And current vet prefers only to trim one wing instead of two. Ooh, that's interesting.
Mm-hmm. Yeah. Well, what
What's
was
your
the thing?
thoughts? What's
Let's
your
go with
thoughts on that?
the cuttle bone and the beak thing. What's the cuttle bone and the beak thing?
Oh, they don't use a cuttle bone for their beak, so they
No, they
have.
don't use the cuttle bone. The cuttle bone is not a beak sharpener or a beak, some type of um, I don't know, device to shorten the beak or anything of that nature. That's not most of the beak itself is going to be. I mean, they can bite and they can do different things and exercise the beak and tearing apart different things. And but it's normal occlusion that is what is really something that maintains the beak length. The the in the cuttle bone is saw it's a calcium source. A mineral block's a calcium source. It has nothing to do with beak uh, length or anything of that nature, sharpening or anything. And then the next thing was
The vet prefers to trim just one wing to
yeah,
trim.
yeah, okay. Um, and so we get into feather trimming for the flight reduction. Okay, and so when you look at feather trimming for flight reduction, you'll see a lot of opines. You'll see a lot of opinions, and a lot of people do, yeah, and have different ideas about feather trimming and then to reduce the flight capabilities of a bird. And so it's kind of kind of a political grenade, if you will, to go and talk about one or the other, with it. And so the aspect I've been doing it for flight restriction for a number of years, and it doesn't trimming the feathers. You never trim the feathers to say you're going to prevent flight. It's just a flight restriction. We have a lot of ceiling fans in the South, and there's a law of the ceiling fan. And you know what the law of the ceiling fan is, don't you, Laura?
You can kind of guess, but why don't you reveal it?
The
It's
big
Murphy's Law.
reveal, huh? If
The
I had a
Murphy's Law, isn't
ceiling
it?
fan going off in my office, I could show you. But the law of the ceiling fan, whatever goes into the ceiling fan goes out of the ceiling fan quicker than it goes into the ceiling fan.
Ah,
Yeah. So if it goes into the ceiling fan at
yeah,
10
yeah.
miles an hour, it will go out of the ceiling fan at 20 miles an hour. Okay. So you can try that. And so, and see that, and it's not conducive to uh, the health of birds. And so you always have to be careful on that. And so there's a number of issues, but for reducing the flight capabilities and been doing it quite a while, and I haven't noticed any significant problem with it, as it is. But we do have and how to trim feathers and whatever. And so we'll do that. And unless you clip a blood feather by mistake, it's not a painful procedure there. Okay, so if you're doing a grooming procedure, like kind of grooming the beak to make it look good, or and you're doing the claws and you're doing a feather trim. You start with the feather trim and then you go to the beak, and then the last one is the nail, claws, because it is the one that will have the pain. But the feather trim we teach here, everybody has their own thoughts and everything like that, but we teach where we trim both wings symmetrically, and we want the bird to have some ability to control its ability to land and flight. And we want lift with the bird. We don't want the bird to drop like a rock. And of course, African grays, Lisa being an African gray can tell us that, if they fall, they have a tendency to kind of lacerate and have a laceration on the keel. And so you want some lift, and you don't want to prevent flight, but you also want the bird to be able to control where it's going to land. And so with only one wing, we don't, teach that here at LSU, and for those reasons. And so that's what I would, and that's why I would encourage that any bird that you have the wings trimmed to do both wings on that.
Okay. So someone has a question. Years ago, I had a bad experience with a water-soluble vitamin. That's a very long story. They said after that, they used dry vitamin that they could put on the food. Currently, they're using Avian Plus. Can you recommend another dry brand, or is this one good enough? Avian Plus dry vitamin.
Avian Plus. I'm not sure who manufactures that. Not sure who manufactures that. I know, the vitamins, again, there are really two vitamins that I recommend at this time, vitamin supplementation. One is the Lafeber vitamin. And so they have vitamin supplementations, and I know that Dr. Lafeber's been offering this product it was called Vivi 13 for many years. And I think there's been a little rebranding of that. It's not Vivi 13, but it's a vitamin supplementation. And that's what I would recommend. And the Necton products are two vitamin products that supplements that I would recommend. They're dry vitamins, and water soluble. There's again, if the vitamin in you have a bad experience with water soluble, the one thing that you always have to be concerned about with water soluble vitamins is that one is that it taints, obviously it taints the water, right? So it's you're the taste, the coloration, what have you, it's going to the bird may be adverse to drinking anything, may not want to drink the water, so, and that's one problem. And that's always the problem we have with adding medication to the water. Is the bird going to drink the water? And so but that's another issue. And then also you have with vitamins in the water, you have the degradation as the vitamin. How long will the vitamin be there and be in its optimum effect? So it starts degrading when you put it in, and how long is it going to maintain its maximum efficacy, once the bird drinks it. Yeah.
Question that's kind of going back to the nail trimming. Wants to know, when you say nail trim, is it a Drexel or a clip or another way the way that you do the trim?
Okay. And so we call it a claw trim. Okay. And the one thing that we call it a claw trim because you have a kind of kind of a bony area in the claw, and that bony area is surrounded by vascular tissue, which is blood tissue. And what's that blood tissue do? It supports that area that's covering it, the claw, the keratin sheath that you see on the outside, the hard part, and supports it and supplies oxygen and nutrients for cell health and growth and underneath. And so if you look at the claw here, you'll see that inside is this surrounding this kind of a bone, tissue, base of the claw is a vascular tissue, which is tissue that is again blood. Okay, and the blood is supplying the life to the cells in the claw. Now, if you use a clip, and you can use a Resco nail trimmer, and you can put that right here and you clip it, boom. You can use human toenail clippers and boom, clip it right off. But guess what's going to happen? You're clipping right there at that vascular layer at the appropriate site, and it's going to bleed. Okay, and so you're going to have to stop the bleeding. Okay, because it can bleed quite a bit. Okay, and so as I've mentioned, so so we don't trim them with clippers. We'll use a Dremel tool. So not a Dremel tool that has a burr on it, and they'll use these, and even dog claws. They'll use a Dremel tool in certain situations. Mainly, I think, in show dogs and stuff like that. But you use that, and when you do that, it generates some heat here, and then that helps as you cut it. That helps with provide hemostasis. And so for small birds that are under 150 grams, green cheek conures, cockatiels, parrots, budgies, small conures, will use electric artery unit, and really quickly with the small claws, just go right through it real quick with electric artery, and that prevents or really reduces. I'm going to always say reduces the chance of any type of bleeding. The last thing that we do is after we trim the claws, we squeeze the toes. We squeeze the toes, because when we squeeze the toes, that increases the blood pressure at the tips of those claws. So when you get back out of the car, you're not going to have blood coming from the toes. We want to make sure if we can squeeze the toes and we don't have bleeding after the nail trim or the claw trim, then it is highly unlikely you'll get out in the car and have blood coming from one of those claws, you see. And so that's what the last thing that we do when we do it. And we use a little silver nitrate to kind of target if we have bleeding. We'll stop the bleeding to what we can see, obviously. And then, like I said, we'll squeeze those toes to increase that blood pressure at the tip. And if we don't have bleeding after we squeeze the toes, you're good to go.
Wow. Okay. That's a little pinch goodbye, squeeze.
Yes, indeed. Yeah. Mm-hmm.
All right. So someone said that they heard that red pepper flakes help with pain, and they want to know if that's true.
Red pepper flakes.
I'm imagining like the ones you sprinkle on pizza, but that's just because I like pizza.
Does that cause pain, or does that
if it helps If it
Is that
helps,
what is it? Capsation? Is it the what is it? The capsation level or whatever, the heat level of the pepper? But no. Let's just say it's red pepper. Let's say it's a Tabasco pepper, habanero pepper, jalapeno pepper, red pepper. Heat. Or cayenne pepper is, but does it reduce pain? The question is, how is it administered? And is it like a topical? I think that there's some topical things that you can use, but I don't know. I'm not. It would have to be how is it used, and and what type of pain is it used for. On that, and that brings up a point, because we have a lot of things that you look at, and we have a lot of medications that we use to try to reduce pain, and there's been studies to see, well, how well does this medication work to reduce pain, and so we have these studies, and we're doing the best that we can at this point in history to try to determine if these medications will really reduce pain. And so the problem is that it's very superficial. It's only one way that you're measuring the ability of this agent or medication to reduce pain, say heat, thermal, but that there's many different types of pain, and you have pain centers in your brain, and so it's like you've experienced different types of pain that's different from if somebody punches you in the stomach, or you hit your head against the edge of a counter, or you get a pin stuck into your foot or hand. There's different migraine headache. There's just different types of pain, and so it's like, and then there's pain associated with a thermal burn. You put your hand on a hot stove, or your pain if you drink hot coffee or something like that, and so we really have, and we're looking at it, and so this is one of the things that you talk about here is, does red pepper prevent?
oh, sorry, it's fed to the bird, by the way. I just got clear. It's being fed to the bird, not, yeah.
It's being fed to the bird.
Yeah.
And so as far as being fed to the bird, I'm not sure there's any evidence that it does. Okay, just to be cut to the chase there's no evidence that red pepper is going to, and I'm not saying that it can't, but I don't think that there's any studies that have been done on red pepper in birds to determine if it reduces pain, to my knowledge. Yeah.
Okay.
But
Just real.
yeah.
So they say that parrots, they can tolerate higher, like hotter peppers than we, like, if they eat them.
Yeah. I mean, that's one of the things that they say. I mean, it doesn't necessarily mean that it reduces pain, but if you say, oh man, squirrels are getting into my bird feeder. Oh, they're eating all of the little nuts and things that I put out in my bird feeder. And so you look online and, oh, put cayenne pepper in your bird feeder, because squirrels can't tolerate cayenne pepper and birds can, right? I've done that. All right. And it didn't stop the birds and it didn't stop the squirrels. So I don't know what to say. So, but as far as, sometimes, and so you have these type situations, and we practice in a lot of in kind of a netherworld, when you're looking at avian medicine and you're looking at companion exotic animal medicine, because we don't have a lot of evidence-based information. Does this work on this species? Does this work on that species? And so it's like, well, you're feeding red pepper to the bird. Is it tolerating it? Is there any consequences of doing that? If there aren't consequences, that if we find and people have done it and have, put their toe in the water as far as treating with this, and you can look on Vin and see, oh yeah, we've done this and nothing's happened, or this is good, or whatever, and and so and no side effects. Like I said, I don't, with probiotics, I don't believe that we haven't seen any side effects, adverse side effects. And so, and so with the red pepper, so what the next thing we do, as we're using it, it's like, well, does it stop pain? Well, the bird's limping around. It can get on one leg, it's limping around. And so you start feeding it red pepper, and the next thing you know, the bird's like hopping around and doing backflips and running all around the cage, and it's not limping around anymore. Then you go like, oh man, the only thing I've done different is feed it red pepper. So that red pepper must be providing some pain. You look at a cause and effect, and that's just, just kind of, that's what you would kind of do with that. And that's some of the medication where we don't have any evidence to show that it does work or it doesn't work. But if it's relatively safe and there's no adverse side effects, you give it in certain situation where you may see a pain, and then if it all of a sudden there's no evidence of that pain, then there's say, well, hey, it in fact it may work because it looks like it's helping with this particular problem. So that's something that you can, one way to find out. But I don't think that there's anything one way or the other on that.
So this will probably be our last question if we have time. One more, Raph, one more.
Well, it's Halloween.
I know, and I think it's kind of funny that, so we've had a lot of questions about Cuttlebone, which is probably the closest you can get to a skeleton, and it's kind of Halloweenish. Right?
Yes, it is. It is. I've seen a lot of, yeah.
All right, so this one's Cuttlebone. So they have two hormonal budgies that have been, they've been hormonal since last spring. No eggs yet, thank God. They're mating, and she is demolishing 2 Cuttlebones a week. And so she was told to remove the Cuttlebones as it could be hormonal chewing. So is there any harm in this? They've not used them for months. They eat rowdy bush, nutri-berries, and veggies. So you've got just a female just tearing through the 2 Cuttlebones a week. So is that bad? Is that something?
And this is the question: tearing through them or actually ingesting them? You see, they can just tear them up, and you just have pieces of Cuttlebone all on the, like they'll chew up newspaper into little bitty shreds, like budgies will do. I mean, gosh, it's confetti. But are they just tearing the Cuttlebone up, or they're actually all you have left is that hard layer on the inside? If it's just tearing it up, then what I would recommend is getting a mineral block in there for them, and then that's, but that's what could be going on, I would say. And that's
Okay.
I don't think that I would say that they're necessarily ingesting the whole cuttle bone, but you know, tearing it up. Yeah.
All right. I think, if anyone, so it's kind of interesting if you actually see a picture of a cuttlebone fish, it's pretty, it's not what you, I mean, it's something when I looked at, I was like, well, that's what cuttlebone comes from. It's, I don't know if you can see, but like, it's this right here is like the fish and there's cuttlebone.
No, there you go. Well, thank you.
It kind of looks
They
like
get big ones too. Big ones too.
yeah, I mean, this thing is, yeah, that's the cuttlebone fish.
Yeah.
It's actually a skeleton. Yeah.
Um,
Oh,
but-
I'm sorry. Follow-up was just the Keats. They're just chewing. They're chewing.
Yeah. So I would get a mineral block. Yeah. And say, good luck with that, because then they can just, you know, that they can get, just kind of shred that, and they'll do fine with that. Yeah.
Okay. All right. I think that is all we have time for today. It's, people gotta go out and just, a reminder that, just keep your birds safe this Halloween. What's your biggest safety tip, Dr. Tully? Well, I mean, there's so many. Like, one is obviously don't let your bird escape when you open the door for trick-or-treaters. Right?
Yeah, I would say don't feed it candy.
Yeah.
Give it a variety of NutriBerries or Avocats or something like that, for Halloween treats.
There you go. Or the pup. We got remember you guessed the flavor.
Pumpkin spice, yeah.
That's right. The pumpkin spice NutriBerries.
Yes, indeed.
And if I can add in one thing, it's better off if you can move the birds out of the view of all the costumes coming in, because they might freak the birds out a little bit more.
Oh gosh, yes. And Lisa, how has your flock responded to your look today?
I have not been in there yet. I know Emma is not going to like it. I'm going to try to get a picture with Sam, because she tends to be the calmest of everybody. So we'll see how that goes.
They're gonna be like, oh my gosh, who is this big ginormous?
Well, you know what I like? I like Lisa's picture right there. It looks like she has ears coming from.
Yeah, it does. You got the weird.
Yep.
Oh
There we go.
Hey, can we see your costume from the side again? Because that really seals the deal. Like the eyes on the side.
Yeah, I think so. I like that.
I almost feel like you could go like the Met, that fashion event with that on, and you would be quite.
Oh yeah, look at that. I mean, that is a gray, huh?
I have a full tail.
Yeah. And it's one piece. That's a cape, just to let you all know. Like that's like you could wear that year round, just
Yes, and I actually had this made because last year I was dressed up as a parrot, and somebody wrote to me after one of the webinars and said, well, really cute parrot costume, but it wasn't a gray. So here you go.
I love it.
Fantastic. Challenge accepted and challenge completed. I love it. I love it. Oh my gosh. Okay. Wow. So our themes today, it seemed to be cuttlebone, mineral rock, and claw trims. I love it. I love how we have like.
Yes, we have topics. You can almost put the topic of the day. It just happens.
Webinar, ask the best about
different. Yeah.
An excellent drawing as always. You nailed it. Ha, I love to see that draw. All right, guys. On that note, I'm going to wish everyone a wonderful Halloween. If you celebrate it, if you don't, just enjoy yourself. Hope your birds enjoy it too, from a very safe point of view. So, have a great weekend. Until next time, see you. And then, just real quick, we'll be with you, Lisa, next Friday, right? Holiday safety. So there you go.
All right.
Join us then, and we'll see.
Thank you so much, Laura. Lisa, good to see you. Excellent. Great Halloween. And most of all, to all of the webinar attendees, great questions as always, and fantastic.
All right. Thank you, Dr.
Happy
Tully.
Halloween.
Yes. Thank you for wearing the mask the entire time. I love it. Bye. Have a great weekend, guys.